Well, welcome to everyone, and thank you very much for joining us. Those of you that are joining us live right at this moment, and also for those of you that will be listening to this as a recorded presentation. We also would like to warmly welcome our guests and panelists today, and I'll introduce those a little bit later in the program. FIP's vision is a world where everyone benefits from access to safe, effective, and quality and affordable medicines, health technologies. Our mission is to support global health by enabling the advancement of pharmaceutical practice, sciences, and education. My name is Robert Sindelar, and I'll serve as co-moderator, and I'm serving in that role due to the honor I have of chairing the FIP Data Intelligence Commission. We're really excited about delivering this event. This is the fourth of 6 regional events around creating development goals and indicators, bridging data and outcomes. I'd also like to introduce you to my co-moderator, Chris John. He is the FIP lead for evidence and impact digital event programs that you have been viewing. He's the FIP lead for data intelligence and also serves as the FIP Data and Intelligence Commission Secretary and does a fantastic job with that. Thank you so much, Chris. Next slide, please. Today, the webinar is being recorded, as I said, and will be live streamed via YouTube. The recording will be available on the FIP events site, so please take a look. You may ask questions using the question box that's provided, and we really encourage you to feel free to ask questions both during the presentations and during the panel discussions. You're welcome to provide feedback when the webinar is over through the webinars page or information email for FIP. And if you're not a member of FIP, we really encourage you to consider joining. So next slide, please. Today, I think we have an exciting program. We're going to do a brief introduction, really talking about developing a needs-based, data-driven culture and why that's important. We're going to talk about the FIP development goals and talk about them from a regional and national priorities perspective. We're going to talk about the development and use of indicators to track the progress with the FIP development goals. And then we're going to have a panel discussion that really brings forward some outstanding individuals that will bring both a regional and a national perspective. What should be measured, how will contribute to tracking the progress against the development goals, and so on. And then Chris is going to do kind of a summary and close us off. Next slide, please. The learning objectives today are pretty straightforward. We're going to outline why a needs-based, data-driven culture is important. We hope to be successful in identifying approaches to measuring progress towards universal health coverage and health-related development goals. We'll describe the FIP development priorities and how indicators were developed, and we'll explain how monitoring and evaluation of development goals contributes to evidence of outcomes and impact. Next slide, please. Chris is going to go ahead and talk about the FIP development goals. Chris?
Thanks, Bob. Hi, everyone. We wouldn't be here today without the FIP development goals, which were launched by FIP back in September 2020, and they're a key resource for transforming the pharmacy profession over the next decade and to transform the profession regionally, nationally, and globally, actually. So they align with FIP's mission to support global health by enabling the advancement of pharmaceutical practice, sciences, and education, and are set to transform pharmacy in alignment with other global imperatives underpinning the UN Sustainable Development Goals, and particularly the Sustainable Development Goal relating to health. All the FIP development goals align and map to the UN Sustainable Development Goals, so progress towards the development goals will mean progress towards that goal and indeed universal health coverage. Bob mentioned that this event is part of a series of events on evidence and impact, and these events directly map to 2 development goals, 11 and 12. 11, you see on the screen right now, is impact and outcomes. Each development goal splits into 3 elements: workforce and education, practice and science. So you'll see with this particular development goal with relation to workforce and education, evidence of impact of the pharmaceutical workforce is that element. And then for practice, evidence of the impact of pharmaceutical services in terms of health outcomes and quality of life, improved efficiency of health systems and sustainability. And the science element is about having strategies and programs in place to enable timely access to safe, effective, and affordable medical products. This event also aligns with Development Goal 12, which is pharmacy intelligence, and the workforce element of that is having a national strategy and corresponding actions to collate and share workforce data and workforce planning activities. The practice element is about having a comprehensive national strategy to collate, share, and utilize intelligence on service provision, development, and delivery. And then the science element is about having data-driven decision strategies to accelerate pharmaceutical research and development. The FIP Global Pharmaceutical Observatory is the engine room of global pharmaceutical data collection, and although it links very closely to Development Goal 12 there, it is also aligned with all the development goals because it will be key to collecting data for those development goals. And the FIP GPO will measure progress towards the development goals, and that's why we're here today. We're going to be talking about development goal indicators that will measure progress. The observatory's mission centers around data, intelligence, advocacy, and reporting. We know from the pandemic the importance of data, and data is important to us also to provide us with evidence which demonstrates impact. So our first task is always to collate valid global data on workforce, education, practice, and pharmaceutical science. We must undertake comprehensive analysis of collated data to provide accessible, high-quality intelligence. And all this must be communicated innovatively to promote our member organizations' impact on health. The communication of this data and intelligence will often be via the FIP Atlas, which is our visualization platform, and we use dashboards to display our data and intelligence across the globe. Finally, we provide evidence-based strategic information, reports, and guidance on the application of pharmaceutical science, policies, practices, and services. I'll briefly give you an overview of the work of the Global Pharmaceutical Observatory. One of the main programs we have is the Multinational Needs Assessment Program, where we take a tried and tested needs-based approach to addressing data and development goal challenges. And we've had several projects running this year within that program. You may have come across one of them, which was about advocating the role of pharmacists in vaccinations, and we were particularly looking at booster vaccinations and some other vaccinations like COVID-19 and meningococcal. The GPO Atlas, as I've mentioned, is for showcasing our members' needs and priorities, supported by data from the GPO. And this allows us to identify opportunities for developing pharmacy with, for, and through our member organizations. The GPO database is the repository for FIP's pharmacy and pharmaceutical science data. It contains data that informs the indicators used to track progress against the development goals. The FIP development goals obviously provide the framework for needs assessments and prioritization for member organizations to undertake relevant to their national strategies. And we'll be talking to the panelists later about their national priorities and what needs to be measured, perhaps. These priorities in turn provide us, each organization, with the foundation for mapping the progress and transformation for their workforce, practice, and pharmaceutical science. And we will use indicators, developmental indicators, as a way to measure and monitor progress and transformations for our member organizations and their nation's workforce, for their practice and pharmaceutical science. Bob will be talking in a second a bit about the Data and Intelligence Commission, who provides strategic advice on the direction of travel of the GPO. And we also have a Data Intelligence Digital Events program with, this event today is part of that. So I'll hand you back to Bob.
Great. Thank you very much, Chris. I'd like to tell you a little bit about the Data Intelligence Commission. It meets on a regular basis. The commission is composed of outstanding individuals from across the global perspective of FIP and the various activities of FIP. The commission provides strategic advice to FIP on the advocacy and delivery of the GPO program. The commission has made recently 8 recommendations as steps to the development of needs-based data-driven culture. And I'd like to go ahead and actually tell you about those. FIP should develop common and accessible guidance and terminology on data collection, processing, synthesis, and analysis. We recommended that FIP should adopt and adapt for the pharmacy practice and pharmaceutical sciences community the WHO data principles. We encouraged FIP to consider what it can offer to member organizations as added value to their membership with respect to data. We recommended that FIP should serve as a global resource for collecting and disseminating the very best data practices and successes. We believe data health, population health management, and data literacy learning outcomes should be incorporated into pharmacy's initial education and training curricula, and also post-registration competency frameworks to continue our professional development. We encourage FIP to continue to advocate for pharmacy to have full access and writability to a patient's electronic health records. We want FIP GPO to develop a clear and transparent governance process to enable data sharing between member organizations and amongst member organizations. And each FIP structure, constituency, forum should identify a data champion who can be supported by the GPO team. Chris?
Thanks, Bob. So to the FIP development goal indicators and our reason for being here today. I mentioned earlier that we have the FIP development goals underpinned by the elements, workforce, practice, and science. That in turn is underpinned by the mechanisms, which are tools and structures to facilitate and support the process of transformation, which are in turn underpinned by the indicators, which will be used for measuring and monitoring the progress of the development goals. Indicators will be used to support member organizations and nations to identify where improvements are needed, to set priorities for quality improvement and support, to create national dashboards as part of the Atlas, sometimes displaying data against priority development goals, to benchmark performance against international data, to support national quality improvement schemes, and also to demonstrate progress that pharmacy is making in support of health systems outcomes.
Thank you. I have the pleasure of introducing our first speaker, but before I do that, I want to mention to our audience that the full bios of each of our speakers and panelists will be included in the chat as they come along. No matter how well we were to introduce anybody, we can't possibly capture really their tremendous accomplishments and all of their talents. So please do take a look at the chat for the full bio. But our first speaker today is Dr. Lena Bader. Dr. Bader is the FIP lead for equity, sustainability, and policy and development. She leads the FIP Development Goals and this program of work. And it's great that she's also a UK trained and registered pharmacist, and she brings that really to bear here. Dr. Bader?
Thank you so much, Bob, for that kind introduction, and to Chris for setting the scene. I'm very pleased to be here today and to be participating in this really important event, part of a much wider series that focuses on indicators, such an important topic. So really today I'd like to share some of the regional, global also, and national priorities with a focus on Southeast Asia and what we've done since launching the development goals. It's really important to emphasize the importance of indicators in pharmacy transformation. Without indicators, we cannot measure progress, but also we do need to identify priorities in order to have a clear plan. 21 goals is far too many for most countries, and that's why we have committed since launching the goals to supporting our members with identifying their priorities. So the next slide reminds you all of a report we launched last year, almost a year after first launching the goals in 2020. We followed that in 2021 with this report, setting goals for the decade ahead. The day we launched the goals, we actually committed to supporting our members identify their priorities. And that's exactly what we did in the weeks and months following the launch of the development goals, leading to this global report. So let me tell you a little bit about what we did. The next slide reminds everyone and emphasizes that, of course, we have full coverage of the 6 regions of the world, and that this report provides a high-level overview of the results of our global engagement and needs assessment with the 6 regions and, of course, our members in those 6 regions. And in the next slide is an overview of how we've done that. So over 2021, over many months, starting with April, we have conducted high-level meetings with member organizations. We've also first run the regional engagement meetings virtually following the COVID-19 pandemic. And in the summer, between July and September, we have followed that with a second set of regional engagement meetings. So we're talking about 6 engagement meetings in every set of these. In October, we have continued with more member interviews to gain a more in-depth understanding of their needs and priorities based on some of the results from the engagement meetings. And in November, we closed with a third set of regional engagement meetings. The regional engagement meetings and strategy really continues to this day, to 2022, and will be an important and integral part of FIP's member engagement strategy in the years to come. So, and all of this is in the report, but the next slide shows you this chart, very colorful. It provides a very high-level summary of what the global priorities are based on what our members across the 6 regions have told us. So you'll see that the all 21 goals have been mapped somewhat, but of course the number of countries which have reported each of these goals as a priority vary and differ across the goals. You can see some of the goals with the highest bar, such as goal number 7, advancing integrated services, goal 13, policy development, 15, people-centered care, were really very commonly identified as a priority across many countries. Some of the other goals have been more of a priority in less countries than others, but this is an expected outcome. Regional and global variation in terms of priority, completely normal and unexpected. The next slide shows you the same results, but in a slightly different way, maybe simplified. Without undermining the importance of any of the goals, we just divided them into levels just to help us quickly identify the top priority goals, which means identified by more countries than the others. And you'll see here first level priority goals as a result of our regional engagement in 2021 have identified 8 priority goals across the world. Academic capacity, number 1, number 4, advanced and specialist development. Number 7, I mentioned services, integrating services. Number 13, I've mentioned as well, policy development. People-centered care is goal 15. Goals 19 and 20, patient safety, digital health, not surprising, and goal 21, sustainability in pharmacy. And you'll see some of the others, of course, form the second level and third priority level goals. And this hierarchy differs for each region if we look at the regional level. So let's have a look at the Southeast Asia region. So we had 3 member organizations contribute to the regional engagement strategy from India and Indonesia, and these are the results of their priorities as they've described them to us. So the first level priority goals are number 12, pharmacy intelligence, number 15, people-centered care, and number 19, patient safety. So a couple of those are very consistent with the global priorities. Second level priority goals, and I know our panelists later on today will discuss those. They may have changed. We will hear some more reflections about their needs in this. And we completely recognize that these kinds of needs are very flexible and could change over time. But the second level priority goals are 3 of them. Number 4, advanced and specialist development. Number 5, competency development. And number 18 is access to medicines, devices and services. And you'll see the third level priority goals at the bottom there. So these are really important results to help us engage with our members and support them with their development roadmaps. The next slide is more of a breakdown. So these are the 3 members I've mentioned who have contributed to this exercise over the many months. And we continue to build the data set from this region by engaging with more members in Southeast Asia. But we've had 2 members from India and our the national member organization in Indonesia, and you'll see some of the goals they've identified as a priority. So before closing, I'd just like to emphasize first that, of course, a lot of these results are just based on what the members have told us. We don't have many results from this Southeast Asia region, but we continue to build on this. So we will be following up on these priorities with the countries to support them in their transformation journeys based on their priorities. We will provide support to more member organizations, whether from this region or from around the world, with sharing best practices and lessons learned from the region. And we will, of course, engage with more members in the region to gain a better understanding of the regional needs and priorities across this. This is a commitment we've made since day one, and we continue to deliver on. Thank you so much for your engagement and support. We rely on our members to transform pharmacy worldwide. Thank you. Chris, back to you.
Thank you, Lena. Thank you for that in-depth view from a global to a regional to a national level. It's very useful to see the priorities there. I'd now like to introduce a double act for our next part of this event. And I am very pleased to welcome Farah Akwad, who is a colleague, a member of the Global Pharmaceutical Observatory team. And Farah is Regional Engagement Support and Development Manager for FIP. So introducing Diala Kumani. Diala is a researcher and has been researching into the development of the development goal indicators at the FIP UCL Collaborating Centre. Diala is also a member of the Global Pharmaceutical Observatory team. So welcome both, and Farah, please do take the floor.
Thank you so much, Chris, and welcome everyone. In a double act with my colleague Diala, I'll begin our presentation with a brief introduction. So as a summary of what has been shared earlier today, in 2020, FIP published the set of 21 development goals. And as part of the FIP Development Goals, a growing set of global tools, structures, programs are also available to facilitate and support the process of transformation. During 2021 and 2022, FIP focused on engaging with members around the world and supporting them in identifying and mapping their needs on a national and regional level against the development goals. And my colleague Lena just presented some examples of the DG priorities that we collated from Southeast Asia. Using the FIP development goals as a framework, we're now able to answer one key question. What is the pharmaceutical development needs to address national, regional, global healthcare needs? So we're doing this as part of our current engagement strategy. But now, as we mobilize the implementation of the development goals and needs assessments, how will we monitor our progress towards meeting those identified needs and priorities? In order to improve our pharmaceutical healthcare delivery systems, we need to do that. So MOs against their nationally identified development goals, priorities and needs, or regionally, and for FIP to measure our global progress against the identified needs. During our Global Congress in Seville, we continued our discussion on FIP development goals mapping and implementation efforts by different member organizations. And of course, as we mentioned earlier, we will continue to do so with our members to share best practices, experiences, and approaches from our member organizations. For example, during our engagements, we found that many member organizations are also mapping the development goals not only as a needs assessment tool, but also against their outputs, their activities, their structures, and their programs. Lastly, the FIP GPO Data and Intelligence Hub has designed and developed progress indicators to support tracking progress towards these goals. This is to measure progress toward identified national development goals and needs, as we mentioned, and to do national, regional, and global monitoring. Now I'll hand it over to my colleague Diala to give you an overview about these development goals indicators. Diala, over to you.
Thank you, Farah, and thank you, Chris, for this introduction, and thank you all for joining us today at this event. I will start now by giving a brief overview of the project, highlighting the different data collection and data analysis methods used throughout the development process of the Global Development Goals indicators. As we can see here on the slide, the process involved conducting a series of qualitative research methods, including a desktop literature review, followed by a Delphi method, and this was stage 1 of the project. Later, a quantitative online questionnaire was incorporated into the second stage, or the global engagement stage. And I think many of our today's attendees are familiar with this questionnaire image presented on the slide and answer to this questionnaire. So I would like here to thank you all for your valuable contribution. For the analysis, also qualitative and quantitative analysis methods were performed to analyze both stages to develop the final presented list of global FIP development goals indicators. Moving on to the next slide, I will go here into more details about the methodology and the data collection process. As I mentioned in my previous slide, a mixed method research design was used, qualitative and quantitative. And the aim of the stage 1, the qualitative stage, was to identify the initial draft list of global FIP development goals indicators. Therefore, the development of proposed indicators involved first a content analysis of the relevant documents and the existing data collated from global published surveys and reports by WHO and the FIP. This was followed by a Delphi method to identify and develop the potential indicators aligned and mapped to the 21 development goals. The aim of the Delphi method was to reach an initial consensus on the list proposed of indicators assigned by an expert group. And this led to the development of 21 of unvalidated proposed list of indicators covering different aspects of each development goal and ready to be used in the next stage. Subsequently, in stage 2, or the quantitative stage, this stage was aimed to construct the validity of the proposed and validated development goals produced from stage 1 in terms of the indicators' relevancy and availability or accessibility from a global perspective. So the outcome of the Delphi method were presented for wider engagement and used to conduct a global cross-sectional online questionnaire to assess and validate the relevancy and the availability of the 21 proposed list of progress indicators. The 21 questionnaire links were disseminated during a series of FIP digital events held in 2021, and one event was held for each development goal, where the attendees of each digital event who were international pharmacists working across different sectors and career stages participated in this short questionnaire. Also, a follow-up email or an invitation email was also sent to global pharmacy leaders who represent their professional leadership bodies to participate in this questionnaire through the FIP different sections and constituencies as well. Moving to this second slide. This slide shows the analysis and main outcomes of stage 1. As I mentioned, a content analysis approach was undertaken to draft the primary pharmacy core indicators, and the output was the development of the GPO core indicators handbook, comprising a list of 127 pharmacy-related core indicators. And this handbook list was used as input for the Delphi process. Afterward, an expert group of international pharmacists volunteered to contribute in anonymous 2-round Delphi method, and they were asked to assign the relevancy of indicators listed in the GPO indicators handbook and the published FIP development goals mechanism against each of the development goals. The expert group was also asked to provide further review and feedback on the output of the first round. Eventually, after amending and incorporating all expert group comments, an initial consensus was met, and 21 proposed lists of 165 unvalidated indicators were developed aligned to the 21 development goal. Then the output of the Delphi method was formatted into a questionnaire to be used for the global engagement or stage 2 or the stage 2. Moving on to the descriptive data analysis for stage 2 or the online questionnaire stage or the global engagement stage, a total of 755 participants responded to the 21 online questionnaires from different practice areas and the 6 WHO regions. And as we can see here on the map, that the Western Pacific and European regions were the regions with the highest response rate, with 31% and 23% respectively. And the responses from the other 4 regions were nearly evenly distributed, ranging from 10 to 12% of the total response rate each. Moving to this next slide, please, Chris. This is a bit of a heavy slide, and it's showing the statistical analysis performed for the same stage based on the 2 questions listed in the online questionnaire about describing the relevancy and the availability of the proposed indicators. 2 selection criteria were set to determine if an indicator is a globally valid and measurable indicator. So as we can see here on the slide, the first criterion is the relevance of the proposed indicators to measure progress for each relevant development goal from a global perspective. And the second criterion is the availability or the accessibility of these proposed indicators in different countries. The analysis of the questionnaire responses was performed using 2 statistical approach. This figure here shows the first approach, which is the outliers detection using the box plot examination to identify the not relevant indicator. The analysis resulted in the exclusion of 10 indicators from the initially proposed list, from the 165 indicators. The second figure shows the second approach, which was done by setting or establishing 3 evidence-based threshold. If we can move to the next figure, please, Chris. Yeah. So this evidence-based threshold to indicate the level of performance or the level of usability of these indicators. So as illustrated here on the diagram, for example, if the availability of an indicator is equal or above 60%, it's classified as a usable indicator. If the availability is between 40 to 59%, it's classified as a problematic indicator. And if the availability is below 40%, it's classified as a not usable or rejected indicator. For analysis reason, only the relevant indicators which pass the first criterion were used and compared with the country responses to ensure the indicators' availability and accessibility in order to meet the second criterion. And the analysis of this stage generated 109 usable indicators or approved indicators ready to be tested after meeting both criteria, and generated also 40 problematic indicators to be reviewed later and 16 indicators that were rejected. Moving to the final slide now, I will point out here the resulting key outcomes. First, the main outcome is a set of correlated and validated transnational evidence-based indicators that will monitor development goals progress worldwide and support countries in the process of their pharmacy advancement and transformation. The second outcome is that the final list of development goals indicators was presented in the 21 development goals and across the 3 development goals elements, workforce, education, practice, and science, which with 1 indicator under each development goal at least. Here it's also worth mentioning that some development goals, particularly the one thanks, Chris. The one that we can see here on the slide, Development Goal 11, Impact and Outcomes, Development Goal 12, Pharmacy Intelligence, and DG 12, Digital Health, have only 1 or 2 indicators under the final list of approved indicators. However, the questionnaire analysis showed that the initially proposed indicators of these goals were relevant to the context area of these DGs. They met the first criterion of a measurable global indicator in terms of the relevancy, but they didn't meet the second criterion, the availability and accessibility assessment in the respondent countries. But I think here we can agree that, or we can say that although data and intelligence, the focus areas of these DGs are considered new emerging and show rapid growth in the healthcare field, the existence of national strategies and systems of implementation is still relatively limited. And then a lack of measures to monitor service impact and health outcomes is expected. Finally, the developed list of indicators was also clustered into 5 categories to present the developed goals and development goals indicators as a second dimension. So, for example, we have capacity type indicators where data is expressed as numbers, like the number of pharmacists, pharmacies, etc. We have impact type indicators to measure the impact and health outcomes of the pharmaceutical services provided. We also have pharmaceutical services and facilities indicators, which focus on the availability of the pharmaceutical services, facilities, and infrastructures needed. We also have policies and regulatory system indicators, which focus on the regulation and strategies as driver to shape the structure of the needed system to improve health outcomes. And finally, we have training and professional development type indicators, which focus on developing competencies and skills across all sectors and career stages. This was a short overview of how the global FIP development goals were developed as evidence-driven global developmental work using research methods to support tracking progress toward the FIP development goals. Thank you all for your listening, and I will hand it over again now to my colleague Farah. She will take you through the project next step. Farah, the floor is yours.
Thank you, Diala.
Thank you.
So as you've heard from Diala, this globally validated list of indicators across all of the development goals will be used to monitor progress worldwide and to support each country in the process of transformation for our workforce, education, practice in pharmaceutical science. And FIP is preparing a tool for the selection of indicators and a framework for monitoring and evaluating them. This in turn will enable the design of global atlas dashboards that will drive and inform progress toward the development goals. So if we can go to the next slide. The Development Goals Indicators Framework aims to support tracking progress of pharmacy practice, workforce education, and science elements of the development goals at a national or member organizational level. There are 3 specific objectives that will be served by this framework. First, to support member organizations in tracking and monitoring their progress toward achieving the development goals. The second one is to ensure that the development goals monitoring is aligned with existing member organizational or national monitoring frameworks so as to facilitate global comparisons of progress monitoring and improvement activities, addressing data gaps and minimizing the burden of reporting. And the final one is enabling global tracking of the progress of member organizations and stakeholders towards the DGs through the provision and alignment of a global set of indicators that can assist in multinational review of the aggregated data. If we can go to the next slide. Now, what are the intended benefits for the Development Goals Indicators framework? This framework will synergize global, regional, and national monitoring efforts and will provide the following benefits. In order to monitor progress towards the development goals, it can be tailored to specific national and organizational contexts. As we know, there's no one-size-fits-all approach. So the development of a standardized monitoring framework will reduce the variability between nations when it comes to monitoring and integration. In addition to that, it will provide guidance on areas that are not traditionally measured and explored by member nations or organizations. If we can go to the next slide. On the screen, you will see our proposed process for tracking the development goals. So first, selecting the development goals to be tracked. Our recommendation is to follow some steps in order to determine or agree on your priority development goals, which include identifying the general areas in which you're active, the policies and projects that are currently in place and prioritized, or the projects that are currently being implemented in your country. You should also consider the pressing national needs that you wish to address and focus on. For our member organizations and for our stakeholders, you can then identify the top 5 development goals priorities that are relevant to your organization's mission, plans, programs, and needs in a specified time. Then based on these development goals priorities, we select the corresponding and the appropriate indicators. The indicators are useful to provide, as we mentioned, measurable results to demonstrate progress towards the development goals, identify areas needing attention and opportunities for improvement, and supporting continuous improvement, because we know that measurement cannot be undertaken in isolation, and we look forward, as we mentioned earlier, to working with all member organizations to mobilize the use of these indicators. The next step is developing a monitoring and evaluation framework, and we will identify specific questions that need to be addressed in order to assess, track progress towards development goals. For example, what is being monitored? We make links to data sources and how these will be reported. And as you can see on the screen, monitoring is the observation of progress and quality of activities on an ongoing basis, whilst evaluation refers to the process of determining the worth or significance of a service or intervention related to the development goal. The final step is Atlas dashboards, and these can be an effective tool for presenting all of this data and changes over time to inform and drive improvement. It's possible to provide a summary of a limited set of key indicators with novel ways of highlighting areas in which the profession is developing or experiencing some challenges. And these have potential to support regular reviews, progress, monitoring best practices and trends to improving data quality. If we can go to the next slide. I think this is the last one. Thank you, everyone. If you have any questions, we're happy to address these in the Q&A box. I'll hand it over to Bob.
Great, thank you so very much. And I hope that if anybody has any questions, please do ask them in the Q&A box at the lower part of your Zoom screen. Now I think we've come to an exciting part of the program today, and that's our panel discussion. So welcome, panelists. I want to thank you all for contributing your time today. I know how busy all of you are. And I'd like to go ahead and introduce each of the panelists, and then we'll ask them some questions. And by all means, please feel free to submit your own questions. Also, their full bios will be in the chat, so do please take a look. So our first panelist is Dr. Rao Vadlamudi. He is a member of the FIP Data and Intelligence Commission. He's Professional Secretary, Southeast Asia Regional Pharmaceutical Forum, and he's President of the Commonwealth Pharmacists Association. Next slide, please. Dr. Subhash Mandal. He's Vice President, Chairperson, Regulatory Affairs Division of the Indian Pharmaceutical Association. He's Associate Editor of Pharmacy Educational Journal. He served in several important committees and task force formed by different government and international agencies. Next slide, please. We're pleased to have Ms. Chitha Abawardena, and excuse me for mispronouncing your name. She's past president, Pharmaceutical Society of Sri Lanka, works in WHO country office of Sri Lanka as a national consultant on essential medicines, and she advises National Medicines Regulatory Authority, the MMRA of Sri Lanka. I'm very glad to have her with us. And our fourth panelist is Mrs. Dita Noviati Sugandhi Arga Di Raja. She's Secretary of Director General of the Pharmaceutical Care and Medical Devices, Ministry of Health in Indonesia. And she served as Director of Pharmaceutical Services at the Ministry of Health in Indonesia. So fantastic panel. If I might, I think maybe the best way to start, and we'll start with Dita and then the Chitha and continue on, is if I might ask this question. Do the regional development goals and priorities described earlier by Dr. Lena Bader's session resonate with your national needs? Do the regional development goals and priorities resonate with your national needs? Dita, if you'd start for us.
Thank you, Governor. Indonesia now is in progress to transform our national health system. Ministry of Health is in progressive way to change and improve 6 pillars of the transformation, which are first, primary care, referral care, health system resilience, health financing, health human resource, and digital health and biotechnology. The mentioned 21 development goals or DGs are aligned with our health system transformation in DGs number 4, advanced and specialist development, DGs number 12, pharmacist intelligence, and DGs number 20, digital health. The DGs number 4, advanced and specialist development, is considered to be a priority due to its relation with our transformation agenda on health human resource. In this agenda, we are seeking improvement of healthcare work, a career pathway and specialization that enables them to provide better services to patients, bring changes to society, and provide benefits for the health system. The Ministry of Health is developing a healthcare workers' career pathway that provides clear guidance on the career progress of healthcare workers equipped with the relevant competencies. Indonesian Pharmaceutical Association has developed an advanced practice framework that support the work of Ministry of Health on developing career pathways. Our professional organization is working closely with the Ministry of Health, Ministry of Education, and expert. There will be more progress in the future. We also develop a specialist program for pharmacists that provide deep dive focus competencies in certain area. Working collaboratively with the related physician and medical teams in the mentioned area. In 2020, we, together with the hospital, researchers, and witnesses by Ministry of Health, had launched a specialist program in radiopharmacies that enables pharmacists to enroll and gain specialist competencies in handling radiopharmacy. If we continue to another question, what is our next priority? I will answer that the DGs number 12 and DGs number 20 is also our specialty. Thank you.
Fantastic. Thank you very much. Chida?
Yeah, thank you very much for the opportunity given to me to be a panelist of this event. And also thank you for all the presenters for their valuable inputs, and Lena Bader's sessions are applicable to our national needs as well. However, there are varying situations among countries in the region, and priorities of the national organization are also a little different. If I am to, concentrate on the our organization interests from the point of view of national organization, the Pharmaceutical Society of Sri Lanka, our priority goals are goal number 1, 2, 5, and 9. In addition to those, then goal number 1, which deals with the academic capacity. Why it is we are interested in that is the pharmacy education system in my country is somewhat different from most of other countries in the region. We have 3 different pathways to produce pharmacists with different levels of qualifications under 3 different schemes. University degree programs were started only in the year 2000, and before that, the students who wanted to follow a pharmacy degree had to go to a foreign university, mainly to our neighboring country, India. Sorry.
Okay, great.
Then, can I continue?
Yeah, please do.
The second program to produce pharmacists for the government hospitals is conducted by the Ministry of Health, and the qualification they get is a diploma. The third category is a certificate level qualification, where the students have to follow a course of study in private training institutes and appear for the qualifying examination conducted by the regulatory body. And once qualified, they go to the private sector, mainly to the community pharmacy sector. However, the Pharmaceutical Society is in the progress of negotiating with the government to produce pharmacists only through the universities and to phase out the other programs. The other suggestion is to establish pharmacy technician programs, which is not in existence now in Sri Lanka. At present, degree programs are conducted in 6 government universities and the University Grants Commission. In addition, there is a bridging program for non-graduate pharmacists at the Open University of Sri Lanka. However, with all these different programs in place, still we do not have sufficient pharmaceutical workforce according to our national health needs. In Sri Lanka, we do not have a pharmacy council, and as the regulatory body, the regulatory body in Sri Lanka is the Sri Lanka Medical Council. All pharmacists need to register under the Medical Council, and currently it is extremely difficult to collect data on pharmacists working in different sectors because all are getting the same certificate, and it does not mention the area of practice. Then we are also interested in goal number 2, which is about early career training, is also a priority for us. We do not have well-organized education and training pathways or programs to support post-registration foundation training in clinical practice and pharmaceutical science areas or early career mentoring system to support early career pharmacists. Then goal number 5 is the other one on competency development. Here again, there are no development frameworks in place that support career development and early other pharmacy related competencies. The fourth one we are interested in is goal number 9, continuing professional development strategies. There are no mandatory or well-organized CPD programs for pharmacists other than those offered by the Pharmaceutical Society of Sri Lanka. That is also on ad hoc basis. Thank you very much. That is what I had to present to you.
Fantastic. Thank you so much, Chida. Our next maybe a panelist that can talk about this a little bit would be Subhash.
Good afternoon. Thank you for giving me this opportunity to be a part of this program. And thanks all of our previous speakers for enlightening us regarding all aspects of DG's development goals. And all 21 FDGs is aligned with the objective of Indian Pharmaceutical Association. We have identified 3 priority areas like pharmacy intelligence, that is goal 12, people-centered care, that is goal 15, and patient safety, that is goal 19. Presently in India, about 14 million registered pharmacists and more than 1 million graduates are coming out from more than 3,500 colleges. Presently, Pharmacy Council of India is maintaining the data about number of pharmacists and number of colleges which require to be updated regularly and be available to the policymakers and the people. It is required for mapping of pharmacists as per their working areas, like we are yet to know how many pharmacists are working in community pharmacy or hospital pharmacy. To improve competencies, continuing education is mandatory for renewal of the registration of pharmacists, and recently the Pharmacy Council of India has made exit exam mandatory for diploma in pharmacy for being eligible for registration of pharmacist. But all of these are to be implemented properly. And regarding the patient safety, our last priority, patient safety is already a part of GPP program, but which Indian Pharmaceutical Association are continuing amongst the pharmacists, but we have to go long way to ensure patient safety. IPA is conducting some training program on medication safety. Now they have started, but our regulators require ensuring that presence of pharmacists in the community pharmacy. FIP in association with IPA in undergoing a project to strengthening vaccination competency and advocating Government of India to utilize service of the pharmacist in vaccination. The expert committee is under developing of training program. Lastly, India has already developed its manufacturing ability and considered as pharmacy of the world, and now required to concentrate on pharmacy practice through monitoring, competence development, and generating data to achieve universal care. This is all about from my end. So thank you very much.
Okay, I think that's great. So a couple things. First of all, we've had a little bit of technical difficulty, and we have lost our internet connection to Dr. Vad Lamudi. And if he rejoins us, we'll immediately move him into the panel discussion. The second thing is we did have a question that had appeared asking about pharmacist programs that were available. And each of the panelists, I think, answered that a little bit as we went on. And so I think we're taken care of. So maybe the best way to really kind of pull this all together here as we get kind of to the end of our time is to think about the following. Each of you talked about a regional or national, your priorities are listed. maybe what would be useful is if you could, in thinking about maybe the most important one or two there, okay, what is needed to track progress of that? And what data are you have available or what's missing? In other words, what are the gaps that we need to really address? And maybe what we'll do is we'll look kind of in reverse order of what we did. So Subhash, if you would.
Yes, actually, we are on the process of developing the system of generating data regarding the manpower available and the area of work. We are now we are unable to say how many pharmacists are working in community pharmacy, exactly engage in the practicing pharmacy. So we are on the development of this data from the government point of view, Pharmacy Council point of view, and as well as our association. Secondly, there needs to be mapping the pharmacy forces where they are really engaged, whether they are in academia or in industry or in community pharmacy or hospital. So these sort of gaps are there, and we are trying to develop this. And regarding the generating this outcome, I have got some idea during the presentations of our earlier speakers, and we are trying to adopt all those strategy for the adopting and implementing in true sense of all the DGPs. So thank you very much.
Fantastic. Okay, Chintha?
Yes, thank you. We too have the same problem, as I mentioned in my, when I talked about the pharmacy education system in Sri Lanka. And data is, very difficult because we also don't know in Sri Lanka, because all register under the Sri Lanka Medical Council, and they get the same registration certificate, and they do not maintain different, we don't know where these pharmacies finally working. So at the moment, with our, discussions held with the Sri Lanka Medical Council, they have introduced very recently, now they are going to re-register, all the pharmacists have to apply for re-registration. So by that, we are trying to get numbers practicing in each area. Otherwise, it is really a difficult task. That is another thing we have. Again, that is the thing we are doing at the moment to get data.
That's great. Thank you. And maybe we'll pull together then, Dita, if you could talk from an Indonesian perspective.
Yes. Thank you. If we talk about data, I think we need data to track progress of these priorities in the number of pharmacies that provide services across nation, their competencies profile, their progress on a career, and so on. Until now, in Indonesia, with the hard work and intensive collaboration between stakeholders, Pharmaceutical Association had an information system for pharmacists called SIAP that provides profile of the nation pharmacist activities, competencies, and other reports related to the pharmaceutical practice. However, we are still lacking data on their competencies profile and their progress on a career pathway for advanced practices or Thank you.
Okay, fantastic. Well, this might be a good spot to really kind of pull it together as a close. I'm really sorry we weren't able to bring the real valuable comments from Rao to the discussion because of our technical difficulties, but I think everybody that has joined us, and we really have quite a large group today. Over 70 people have joined us for the event today, and there'll be more that will listen as we go forward. Had a chance to really see the broadness and unique ideas and also the priorities and ways to address these from around the Southeast Asia area. But maybe Chris, do you want to go ahead and wrap up and kind of summarize where we're at?
Thank you, Bob. I will do. So just in wrapping up and concluding, we've heard today of the work of the Global Pharmaceutical Observatory, supported by the FIP Data and Intelligence Commission, and Lena told us about what the developmental priorities are globally and also regionally in Southeast Asia, and some of the national priorities as well. And then we had Farah and Diala talking about the development of our development goal indicators, and that we will be releasing a framework very soon. We do have 109 indicators across the 21 development goals. Obviously today it wasn't possible to show you all of those 109 indicators, but as I say, we will be releasing the framework very soon. And then it was great to hear from our panelists and across nations in Southeast Asia and what their priorities are development goal wise, and what data is likely to be available to monitor progress. So thank you for all of their expertise and wise advice. If you want to know more about the Global Pharmaceutical Observatory, the microsite address is on the screen right now. I know we had a question in the Q&A box about having a look at the dashboards, and there are the dashboards on the website that will show you how we are visualizing data. And a good example of that is pharmacist workforce capacity, so number of pharmacists per 10,000 of population in nations, and that is a very good example of an indicator that we have developed. If you want to check out other FIP digital events, please do visit events.fip.org. There's a very big program of events for you to follow. I'd like to thank all of our speakers for their fantastic presentations, for our expert panelists who gave some really valuable insight into their nations across Southeast Asia. I also would like to give a big thank you to Bob, to Professor Robert Sindelar, who has been a great co-moderator here with us today. And finally, thank you to all for attending today's event, and I wish you a good day wherever you are. Thank you so much.
Thank you very much.